we're helping people to aggregate and secure their health information and monetize them for their data, for clinical research, as well as meeting their health goals.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, here with my friend Krista McFarland, the CEO and founder of Patientory. Krista, always good to see you.
Yes, always good to be here.
It's been a minute since I got an update, so I'm actually very excited to get the 2024 What's Up with Patientory.
Absolutely. So we're really excited about, the support and the resources around launching, our dive into GLP-1s. So as you know, Patientory is a digital health data wallet. We're helping people to aggregate and secure their health information and monetize them for their data, for clinical research, as well as meeting their health goals. And one of the new algorithms we've created is being able to identify, higher BMI patients and giving them the alerts that they need to, rectify the situation by providing them with an easy way to connect with the telehealth provider and get a GLP-1 prescription. We are pretty much, partnered directly with the manufacturers, so it provides us the ability to provide lower cost semaglutides, GLP-1s. As we know, it's a barrier to entry, especially for those who can't afford it, with it being, oftentimes not available.
Yeah. Let's break down exactly how the digital wallet works for health data, because actually I was posting right before this, I posted on our TikTok, like, hey, send me in your questions that you want me to ask founders. And a couple people talked about portable patient records. I want to have access to my records. How do I do that? Who's working on that? So talk to me about how a patient owns their data, accesses their data through a digital wallet.
Yeah, so what we've been working on for the past years, since we launched, is really building a national health information exchange network. And that's what we did. We were pretty much a part of the whole TEFCA. I sit on the Care Equality Board, and really being able to provide the patient voice to information exchange. Fast forward to 2023, we launched the wallet that's built on the network. It's a Web3 decentralized network, so we have the ability to really understand and provide the consents needed to verify a patient and match their medical data that exists in these electronic medical record systems. And that's the beauty of decentralization.
Yeah.
That's the beauty of blockchain technology, because it provides us the resources and the availability to not only secure the data, but to also identify and put those security protocols in place to make sure that the data that we're ingesting from these health systems, are going to the individuals that say that who they are.
What's the state of the industry in terms of the use of blockchain in healthcare? Because you and I talked 5 years ago, and it was like every other word was blockchain. Not so much now. Now it's generative AI. Now it's whatever, which is a good thing. That means, kind of settle out some of the hype, move along in the hype cycle. So where are we now in terms of the acceptance, the use cases for decentralized contracts?
Yeah, I think we've gone through the hype cycle. 5 years ago, it was all about blockchain. We've seen a lot of companies emerge and pretty much fall off, right? We've gone through that valley of despair. And I think now it's really a supplement to what we're seeing now when you talk about Gen AI, because how are we getting these data lakes? So with us, it's been rebranded to Web3 to incorporate these other technologies such as
the hype cycle.
Yeah.
We don't want to do the hype cycle alone.
Right. So now it's Web3, which is inclusive of blockchain, AI, all of these different technologies that we're combining together to really shape this new, I would like to call it the new internet, or an enhanced internet that really provides individuals the ability to participate, right? In our case, in healthcare, it's being able to, control your data. And what we're building with this data marketplace ecosystem, the ability to really understand and control your data and have that portability for your information.
What's been the market's general reception to what you have been selling recently? Like, what's the general vibe you're getting here?
Yeah, at health, a lot of the people I've talked to, it's like, wow, I never thought of that. Why haven't I heard about this before? So we know we have a lot more to do on the marketing side, but
Both good
and challenging, right? So it's both good because we see people say, wow, they didn't think that they would need something like that, or they've never thought of that, being able to monetize their data, or really be able to be empowered to carry around your health information, which typically we trust our health systems today to do that, right? And we don't have that portability. We don't have that control. So it's definitely a mindset shift that has to happen.
But you're not new to that challenge. From the very beginning, you were educating in blockchain as you went through the process. So what's next? I'm excited about it.
Yeah, for us, next year, it's growth. As I mentioned, we started out the marketplace with offering the GLPs with people in the wallet. We have people that are earning rewards through crypto in the wallet today by meeting their health goals. We're looking at new partnerships to continue to grow, new integrations, expanding the medications that we also offer today, right, to meet more of those chronic disease challenges.
When you say the medications we offer, I understand the portable data piece. How does that integrate with offering medications? Like what's practically that piece?
Yeah, so with the data, it's pretty much the ability to recommend more cost-effective medications for our users. As I mentioned, either the GLP-1s that we connect with the marketplace platform today, or, our partnership with MarkCube and Cost Plus Drugs, being able to have people that are, having their medications today find the much cheaper alternative to that and saving costs.
So your data is just a segue to a good recommendation, what you should do next, which just makes sense. There's not like this big leap between your data and the care that you receive.
Yeah, so it's your data really informing you about, better, more quality, cost-affordable care that you can receive.
Is this something that consumers can currently download and take advantage of, or is it going to be? Is it offered through an insurer? Is it offered through somebody else? Like could I go and download the product?
Yes, you can actually download the Patientory wallet today.
I could do it.
Yes, it's available on the iOS and the Google Play Store. So that is available today.
And what will my experience be if I do that?
So pretty much when you download the app, you create a wallet, which is your personal identity in the blockchain. It's represented by this numeric value to secure your identity. So you download the wallet, you verify your identity, you start to integrate your data sources. We integrate today with Apple Watch and Google Fitbit.
Okay.
So that's a way and means to start to, be able to incentivize the activities you do within the app. And then you can sign up for a care plan. So this care plan is pretty much your AI health coach gateway into the marketplace that's offering you these different services.
Got it. Okay. Awesome.
Yeah.
And eventually I'll have maybe more health data from my doctor, from my...
Exactly.
What's those?
Yeah.
Like you too.
Yeah. So we pretty much curate a care profile about every user. You have a health score. So like a credit score rating system. Which also gives perspective on potential buyers of your data, or just, your health providers around, how healthy you're being.
How much could I feasibly make doing this?
We've had people make a couple bucks, like $50, depending on how engaged you are. And that's the beauty of it.
Yeah. So it's more the spirit of the thing. It's like you own it, you make the money. It's not that you're going to get rich off.
Exactly.
It's nobody else is going to get rich off of it. You still own it.
Right. Yeah.
Well, Krista, always great to get the update. Exciting to see the integration of GLP-1 and just the reception as we're in this sort of transitional moment, aren't we?
Yeah, we are, especially as we think about it. I've read somewhere in the next 5 years, it's going to be very rare to find a healthy body than like $1 million or a Rolex watch, right? So as we become a more enabled, tech-dependent society, how are we monitoring our health or feeling challenged and motivated to be more healthy?
Yeah. Well, Krista, thanks for stopping by.
Thank you again. Of course. Thank you.